All right, so this is our first panel. Today or this morning, we'll talk about Texas Health Programs eligibility and enrollment scenarios. I was really hoping that I would have a kind of like overview video pre-recorded before this session, but we didn't get around to it. But it will be available afterwards, and that'll just go over some of the key eligibility categories, which I will get into a little bit today.
Hôm nay tôi
Um,
xin
oh,
bắt đầu về cả
And Hoy or Emma, I think we might still need to make Hoy an interpreter so he can get into that Vietnamese channel. So I'm just, yeah, but I'll move on from here.
So can I start?
Hoy,
Hoy, please check the chat. Thank you.
thanks, Emma. Thanks, Hoy. So this is all some of the overview material that I was going to pre-record before this conference, didn't get a chance to, but it will be available afterwards. But I just want folks to know some of the key categories for information that we'll look at together in that outside of conference material. But the things that I want to focus on today are eligibility categories, and then also one big sort of elephant in the health industry right now in Texas, which is Greg Abbott's executive order that got released last month that will require hospitals across Texas to ask for information about emergency room patients or acute care facility patients' immigration status. So we're going to review that at the top of this conference just to make sure that everybody's aware. And we'll ease into the conversation though with a little bit of overview just about federal and state health coverage programs. So these programs are all ones that most people on this call already know. But again, just to get the conference started for a little bit of easing into the material, the three main programs that we have in the United States created by laws in the 1970s and in the 1990s are Medicare, Medicaid, and the Children's Health Insurance Program. I remember Medicare and Medicaid because Medicare has an R at the end of it, and the word retirement starts with an R also. And so in general, not across the board, but in general, Medicare is for folks who are either older or retired or have certain disabilities. That's a federally funded program. And it's in contrast to Medicaid, which is usually for pregnant people, children, or people with other disabilities. So Medicare ends in an R, which also starts the word retirement, generally for older folks or folks with certain medical conditions, and then Medicaid for children, pregnant people, or people with other medical conditions. The Children's Health Insurance Program listed on the right-hand side there is available for families who maybe make a little bit too much money for Medicaid, but are still relatively low to middle income and have income qualifications that would get their 0 to 18-year-old children into the Children's Health Insurance Program. There's also CHIP perinatal. CHIP perinatal is for CHIP perinatal is for pregnant people who are either not lawfully present in the United States or for pregnant people who make a little bit more money than they qualify for pregnancy Medicaid. So just so everybody knows, that is a really, really amazing program and very, very helpful for people who are pregnant if they are not lawfully present in the United States, but the coverage actually covers the unborn child. So there are only two visits postpartum for people who had CHIP perinatal, and those people who were formerly pregnant who had babies while they were on CHIP perinatal have to get those 2 visits within 60 days of their birth date of their child. So these are kind of like main programs that are available to folks around the US, right? Medicaid now, we have this extra icon here because Medicaid is now also available for 12 months in Texas for people who have newborn children, or for specifically people who are no longer pregnant or mothers, right? So if mothers were on Medicaid while they gave birth, then they have 12 months of postpartum Medicaid, given a law that passed last year, and we're really excited about, and just want to make sure that everybody knows. Postpartum Medicaid no longer ends after 2 months, it ends after 12 months, as long as those moms were on Medicaid when they had their babies. Here are some eligibility guidelines for each of those programs. Again, I'm not going to go through the details, they're on the slides. And now just a quick overview of other programs, right? So we've got Medicare, we've got Medicaid, we've got CHIP. There's also TRICARE for people who are either formerly or currently connected to the US military. There's the Healthy Texas Women Program, which is a family planning program for people who don't have Medicaid or CHIP, but still qualify based on their incomes. Healthy Texas Women is also not available to people who do not have lawfully present status. There's refugee medical assistance, where people apply through the Texas Office of Refugees or for refugees. That is like, it's not Medicaid, but it's a Medicaid-like program for refugees who are within 1 year of being in the United States. When people are no longer eligible for refugee medical assistance after that 1 year, they can then transition over to marketplace health insurance if they're an adult, or if they're children, they would probably already be on Medicaid. Because if you're under 18 and you qualify for refugee medical assistance, usually you qualify for Medicaid also. And then the largest form of employer or of coverage, health insurance coverage in the United States, is of course employer coverage. So we've got this little icon here for employee benefits and perks. There's also healthcare.gov, which we'll talk about at length in this conference. And then there's programs that are like local, right? Local to certain counties, usually for people who are uninsured. Sometimes they're called indigent care programs. I highlighted MAP here, the Medical Access Program, which is Travis County's indigent care program. And so there are lots of those around the state of Texas also. Let's see. The federal programs are generally organized and funded by laws in the Social Security Act and paid for by taxpayer dollars. So all of this is really contingent on all of the health programs and food programs that we have in Texas are really based on laws, which is why we're going to talk so much today in this conference about laws that get passed at federal and state levels and how people can, and how the people at this conference, how assisters really can best translate those laws into coverage and action and like going to the doctor, right? Getting preventive care for people who are in our communities who are looking for affordable health care. So we've got some key eligibility categories here. Age is one, income enough is one, or of course is one as well. Work history is a key eligibility category. All the overlapping components of these eligibility categories drive people towards one of those programs that I listed in that previous slide. So, you know, there's dozens of them. And those dozens of programs, which programs people qualify for, are based on all of the different questions on this slide. So whether somebody has a disability or a medical condition, whether somebody has a certain immigration status or another, whether somebody is pregnant or not, what somebody's household structure looks like, whether they have dependents, whether they are married, how they file even their taxes if they are married, and then whether or not people are in foster care. So I just want to like really celebrate and shout out all of the really incredible work that folks who are on this call right now do, because these are all complicated categories. Every family is unique. I've filled out probably thousands of applications for folks for Medicaid, CHIP, marketplace health insurance. I've never met a family who has the same overlapping components of these different categories. So because there are so many of them and because there are so many programs, it's really, really difficult and incredible work that our assister communities do to help families figure out what they're eligible for and how to get into those programs. So let's see here. Here's just an overview slide also with some more links with all of those eligibility categories listed out. There's just another kind of representation of how complicated getting into those different programs is. And then this here is a torn piece of fabric. What this image represents is the idea that all of those different programs that we saw listed in that previous slide, they all create what folks call like the fabric of our health coverage and food security landscape in Texas and in the United States. But as you can tell from those previous slides, the fabric has holes in it. If people don't fit within the right mixture of eligibility components that I mentioned on those previous slides, then they fall through the fabric, they fall through the gaps, right? And that's so much of the work that our assister community does, is to help make sure that folks know what they can get into so they're not falling through the cracks, or if their eligibility based on one of those categories makes them ineligible for one program, what else are they eligible for, right? Like what other programs are available to them? And it's really tragic when families or individuals or communities get lost in these gaps in the fabric of our health coverage and food access landscapes. And that's why we're all here. That's why we're all here for the next 6 sessions, for the next day and a half, is to really make sure that our sister community and our public health community knows where those gaps are and how they can help families avoid them. And importantly, what programs are out there for people who tend to be like in between those eligibility categories that I listed out earlier. And then the big question always is who's paying, right? We'll go over some scenarios if we have time at the end of this panel as far as like where folks might get their coverage from. But like I mentioned, the IRS is involved in all of these programs. The Social Security Administration creates the laws that pay for these programs. And so the big question is always, who's the payer? What organization or what entity is helping people pay for their healthcare? Because healthcare is so expensive in the United States. That's why when people go to the hospital, if they don't have a health insurance plan or if they're not on Medicaid, the hospital calls them unfunded patients. So they have no funds backing them up for for the cost of their healthcare. So this is a big, I don't want to like draw everything down into the question of money, but because we're in the United States and because we have the health systems that we have, it oftentimes does go back to money. So who's paying for the healthcare? Which program is it? Which pool of federal, state, or local dollars are getting pulled from for people to have access to affordable healthcare? And the next slide is about a very specific question that our governor is asking hospitals to help him answer starting November 1st of this year. Greg Abbott's office introduced this executive order last month in August. And the executive order requires all hospitals and acute care facilities in Texas, that basically the ones that accept Medicaid funding, who are either emergency room care providers or acute care providers. So even like dialysis clinics. So these hospitals are going to have to start asking people starting November 1st what their immigration status is. The executive order does not, I repeat, does not require anybody to answer that question. It just requires the hospital to ask it. So the executive order, what it's trying to do is it's trying to get hospitals to report back to the state how much money, right? It goes back to the payer, it goes back to how much money is getting spent. To go back to the payer, to the hospital and ask the question, how much money are you expending on healthcare for undocumented people? So this executive order is scary for families because word is already out about it, and immigrant families want to make sure that they're not jeopardizing either their immigration applications or their family's immigration applications by going to the hospital. This executive order will create drops in access to medical care among immigrant communities. There's a link here to a Politico article analyzing some of the drops in healthcare that we've for undocumented people that we've seen in Florida, following the passage of a very similar law. And what we want to do here in this space and afterwards is make sure that everybody across the state of Texas knows these two things. One, it is on the left-hand side here, it is 100% legal and actually right now recommended by advocates that everybody across the state of Texas, whether you are an immigrant, a citizen, a legally permanent resident, undocumented, whatever your immigration status is, if you go to the hospital and after November 1st, somebody asks you that question, what's your immigration status? And you can, a sister should share this with members of the public as well. We decline to answer that question. It is fully legal to not answer that question, to not give the governor's office access to the information that they're looking for, which will not give them any information that they don't already know also. So decline to answer the question. Everybody can do that. And then the second thing that we want to make sure everybody knows is that using the hospital is protected by federal laws, right? If people have emergencies, they should go to the hospital. Hospitals are required to serve people, hospitals that require that get public funding, which is many hospitals across the state of Texas, are required to serve people, to treat people, regardless of what their coverage status is, regardless of what their medical condition is. And any access to the programs that help people pay for hospital visits, whether it's Medicaid, whether it's a health insurance plan from an employer, or a health insurance plan from the health insurance marketplace, or whether somebody is uninsured and they dip into a pool of funds that that hospital has, usually called charity care, to help them pay for the cost of their hospital health care. None of those things affect immigration applications. None of them are admissible as public charge considerations. So public charge being the concern that immigration applications have that people will be dependent on the state, or that they will be charges on the public good or the public funds. None of these programs, Medicaid, CHIP perinatal, SNAP food benefits right now, are subject to public charge admissibility tests. So these are the key points connected to the executive order. I just wanted to make sure that we highlight this at the top of this conference. It's a really important development moving forward. Now I'm going to introduce, I'll come back to questions about these. Actually, you know what? Let's take 1 minute and see if we have any questions right now. I'm going to stop sharing my screen for a second, and I'm going to go over and check and see if anything is coming up. And while we're doing this, I will also. Okay, so there is one question. It looks like we have one raised hand as well. Diana, if you could use the Q&A function, and then we'll get to the raised hands and whatnot after this session. But yeah, go ahead. We'll get through the slides, like I said. But the one question that I did see from today is, will this law go, or will this executive order go into effect on November 1st? And most likely, yes, it will. There is not really a legal statute or a case for anybody to make against this executive order, because it is so general, because it is really an information collecting executive order. It has these really scary consequences for our immigrant community members, but that executive order doesn't ask hospitals to do anything illegal. It also still specifies that hospitals should treat people if they are in emergency situations. So in general, we will likely not see legal challenges to this executive order, and it likely will go ahead and take effect on November 1st, which unfortunately also is, of course, the date that marketplace health insurance eligibility opens up for DACA recipients. Ben Davanzo from the National Immigration Legal Center is going to cover that development in our next panel starting at 10:30. But so we've got some confusing messaging, right, that we're dealing with when we're sharing with our immigrant community members at this point. So do not respond to questions when you go to the hospital about your immigration status, but also do report your DACA status on marketplace applications, because you will be eligible for that type of health insurance for the first time starting December 1st. So that's just a heads up also. Everybody on this call is welcome, of course, to join Every Texans Get Covered Coalition, our Seguro Texas Coalition. And I've got slides for later on in the conference with those listed as out as well. But we really want to make sure that our communities are prepared for both of these moments starting November 1st. And the best way for us to do that is to work together and make sure that we're sharing the info and the talking points with community members. So I'll hold off on other questions for now, and I'll introduce our next panelist coming up is Deborah Vizcara from the Capital Area Council of Governments. Deborah, if you go ahead and open up your video, I can see it. I'll mute myself and we'll get started with your slides. So we're on to our next panel topic.
Thank you.
Okay, Deborah, and your slides are up.
Okay, good morning, everyone. My name is Debbie. I'm a benefit counselor with the Area Agency on Aging, and I'm here to discuss Medicare. Next. Topics that we're going to go over is Original Medicare Part A and B, Medicare Savings Program, Extra Help, also known as Low Income Subsidy, what's new for 2025, and any questions that you may have. Next. Medicare eligibility. Medicare is a federal program that offers health insurance to American citizens and other eligible individuals. The program is often called Original Medicare Part A and B. You do have to be a U.S. citizen and a legal resident. You have to live in the U.S. for at least 5 years in a row, including 5 years just before, I'm sorry, I'm having that. Just before applying for Medicare. You also must meet one of the following requirements. You have to be age 65 years old or older, younger than 65 with a qualifying disability, any age with a diagnosis
bị bệnh hay là
of
bị
end-stage
ASL
renal disease
và
or Lou Gehrig's disease, also known as ALS. You and your spouse has worked for 10 years in Medicare in order for Part A to be free. Next. You can choose to get more coverage in regards to Medicare Part D. So let's discuss Part A. Part A includes inpatient hospital insurance and skilled nursing. Part B includes doctor visits and outpatient care. And Part D includes prescription drug coverage. Keep in mind, if you don't enroll in Medicare Part D, you may face penalties. Next. Here you also have optional coverage. You have the Medicare Supplemental Plan, which is also known as Medigap. This plan helps pay the 20% that Medicare doesn't. It also helps with your deductibles and copays. You also have Medicare Part C, also known as an Advantage Plan. This is considered like a bundle plan, which includes your Part A, Part B, and Part D. Some of these plans offer additional benefits, which includes dental, vision, and hearing. Next. What does Medicare cost? Medicare isn't free. The amount you'll pay depends on the coverage you choose and the healthcare services you receive. You do have premiums to pay for Part B. Everybody pays a Part B premium of $174.70. Next year, the premiums may be different. You have deductibles, co-pays, and co-insurance. Next. When can I enroll in Medicare? You want to enroll at least 3 months before you turn 65, the month you turn 65, and 3 months after. If you fail to enroll during this time period, you may face penalties, and it's 10% for every year that you did not enroll. Next. When can I change coverage? You can make any changes through October the 15th through December the 7th. This is called the open enrollment period. You can change from Medicare Advantage plan to another Medicare Advantage plan. Advantage to Original Medicare. You can add or drop Medicare Part D. Next. Medicare Savings Program. Medicare Savings Program helps pay your Medicare cost if you have limited income and savings. There are 3 main programs, each with different benefits and eligibility requirements. You have the qualified Medicare beneficiary. The income limit for this program is $1,275. A couple is $1,704. This helps with your Medicare Part A, Part B, deductibles, coinsurance, and copays. The next one is specified low-income Medicare beneficiary. The income limit is $1,526 individual, $2,064 for a couple. And then last you have the qualifying individual, which is $1,715. 2,320 is for a couple. The asset limit for individual is $9,430. The asset limit for a couple is $14,130. Next. Extra help, also known as low income subsidy. If your monthly income is up to $1,903 in 2024 and your asset is up to $17,220, you may be eligible for extra help. This is done through SSA.gov's website. This helps with your premiums, deductibles, copays, and coinsurance. If you are enrolled in Medicaid, SSI, or Supplemental Security Income, or a Medicare Savings Program, you automatically qualify for extra help, regardless whether you meet extra help's eligibility requirements. Next. Working past 65. You have Medicare decisions to make at the age of 65, even if you have coverage through an employer plan. You can delay enrolling in Medicare Part B if there are more than 20 employees and your employer provides group health coverage and it's considered to be credible. You also want to pay attention to health savings account. If you or your employer is contributing to an HSA or health savings account, you want to stop contributions at least 6 months before enrolling in Medicare A and B. Next. Changes coming to 2025 in regards to Medicare Part D. Beneficiaries out-of-pocket spending is capped at $2,000 for 2025. The protected base beneficiary premium will be $36.78, which is $2.08 more than 2024. Medicare prescription drug plans, Medicare Part D, including both standalone Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage, will offer enrollees the option to pay out-of-pocket prescription drug costs in the form of capped monthly payment instead of all at once at the pharmacy. So basically what they'll be doing is it's like a payment plan that you would need to speak to your insurance company and they will set this up. Next. Here's our phone number on the screen. As I mentioned, open enrollment is coming up October the 15th through December the 7th. If you have any questions, you can contact us at the number listed. And that's it.
Thank you so much, Debbie, sorry.
I do want to mention one other thing. As far as
Yeah.
the premiums for Part B, those premiums can go up.
Trying to go back to that slide.
Right.
What was it? It was like 36.
It was the next.
Go ahead with what you were saying though, sorry.
Okay. The premiums can go up based on your tax records from 2022. So currently, everybody pays a Part B premium of $174.70.
Mhm.
Again, premiums can go up based on your IRMA, and Social Security will determine those premiums.
Gotcha. Yeah, and I've got a slide in a deck that we'll hopefully be able to share later, but that everybody will have access to, that shows like in the Social Security check how much of that gets taken out.
Right.
So when folks get their Social Security checks, there's a little line in there that says this much is being taken out for your Medicare premium. And I just want to like make sure that I heard you right, Deborah. If people fail to enroll within 3 months after their 65th birthday, if they're eligible for Medicare, then they pay a fine, like a 10% higher cost for Medicare for the rest of their lives.
Correct. And the same rule applies to, like I had mentioned, Medicare Part D,
Mhm.
which is 1% for every month that they did not enroll. And it's usually 1% times the base beneficiary premium,
Mhm.
which I think on the maybe second, third to the last slide, it gave an amount of 3708 or 3678. And currently right now,
3678.
yeah, and currently right now, I think it's 3470.
Gotcha. Okay. Well, that's good news about the out-of-pocket spending caps. Thank you so much for this breakdown. I know Medicare is always a tricky topic, and we're just so glad that that the SHIPs, the state health insurance programs, and the area agencies on aging are around to help folks. We do have
Yeah,
some more
they can always give
questions.
us, I'm sorry,
Yeah,
they can always give us a call and we can help fill out the application for the Medicare Savings Program and
cool.
the extra help.
Gotcha. Yeah, the Medicare savings programs are really important. Those are people fill out applications for those through the yourtexasbenefits.com portal.
Mhm.
So Debbie, CapCog or the area agencies on aging can help people with those too.
Correct.
Oh, very cool. Okay, gotcha. Um, and I imagine then also with SNAP food benefits applications, since it's all on Your Texas Benefits, is that right or no?
No, we only
Okay,
assist with the Medicare Savings Program and extra help.
gotcha. Okay. Well, I'll make sure we have those notes in our Assister resources folder here at the end. We do have some more questions, but we gotta power through to the end of the slides here. So our next presenter, thank you so much, Debbie.
You're
Well,
welcome.
I don't know if we'll have time for Q&A at the end because we've got to do like the raffle and all the stuff. But people keep your attendees keep your questions coming. And we will be sure to get to those at least by the end of the conference in written form. So next up, we have Giovanni Terencio, who is with the Texas Workforce Commission, and we'll talk a little bit about the vocational rehabilitation program there, which does offer some pretty remarkable health assistance for folks across the state of Texas. So Giovanni, happy to have you.
Thank you. Good to be here. Welcome, everyone. I'd like to tell you a little bit about a program that a whole lot of people don't know about. We are Texas Workforce Solutions Vocational Rehabilitation. We're a division of Texas Workforce Commission. We used to be DARS, Department of Assistive and Rehabilitative Services, and before that we were Texas Rehabilitation Commission. So they keep changing our name, but our services are here to help individuals with disabilities. Next slide. So Texas Workforce Solutions, if you walk in the door, you're going to any Texas Workforce Commission and say that you're looking for a job. They're going to help you get a job. They're going to show you their resources. They're going to do whatever to help you get a job. There are 28 local workforce boards, state agency all over the state of Texas. Next slide. And I guess, sorry, I should have gone back because it's got abbreviated. But vocational rehabilitation, we are the division that helps people with disabilities. So if you go into a Texas Workforce Commission office and you identify yourself as a person with a disability, then they will refer you, hopefully, to vocational rehabilitation. Usually in the Texas Workforce Commission offices, there are some vocational rehabilitation staff. So I always like to do a did you know there are 19.6 million working age people, and they consider working age 21 to 64 that have a disability. We all know that people actually sometimes start working sooner than that, and people stop working later than that. But of people between 21 and 64, they have identified 19.6 million in the United States as being persons with disabilities. Of that 19.6 million, 1.6 million are working age Texans here in our state. But a lot of people with disabilities don't work. Actually, we have very low employment for individuals with disabilities. Next slide. So I'm going to tell you a little bit about our services, an overview, our adult services, our youth services, a little bit about business services, eligibility requirements, the disabilities that we serve, and how to apply for our services. Next slide. So our adult services, eligibility is based on employment services is based on helping somebody get a job, keep a job, or advance at a job. And so there is no income for eligibility. It's is there a medical reason that is affecting your ability to work? And then we also have a program called Older Individuals Who Are Blind. This program does not involve employment. This is for people that are 55 and older that are losing their eyesight to help them remain independent. So, so again, most of our programs are to help people get a job, keep a job, or advance in a job. But our OIB program is for people that are 55 and losing their eyesight. I had to do 2 weeks under blindfold, and I tell you, it's incredibly frustrating, even though I touch type, being able to use a computer, being able to cook, being able to make your bed, all things that we do on a regular basis are just a whole lot more limited when we don't have the use of our eyes. So the OIB program helps individuals be able to remain independent. Next slide. So some examples of services that vocational rehabilitation can help with are counseling and guidance. Counseling and guidance is written into every plan for employment that we create. It is our #1 service. It could be information and referral. It could be helping with choosing employment goals. There's just all sorts of things that counseling and guidance is for, but this is vocational counseling and guidance. If someone is needing mental health counseling, then yes, we can help get them set up with that if it's affecting their ability to work. But counseling and guidance is our #1 service. Job search assistance, so helping individuals find a job if they're not currently employed. Sometimes we get individuals that they can get a job just fine, but they have trouble keeping a job. And that's because of their disability. And so we provide vocational assistance to help them learn what type of work they're best suited for. Disability-related skills training and assistive technology kind of work hand in hand. We can help individuals figure out if there are assistive technology that would benefit them, and then we not only help them get the assistive technology that they're going to need for work, but we provide the disability-related skills training so that they know how to use that technology. Also, disability-related skills training can be considered for like speech therapy, physical therapy, occupational therapy, things like that. Academic and vocational training. So helping somebody, we start at age 14, so helping them figure out what their plan is when they graduate high school, to someone who has acquired a disability later in life, helping them figure out what they can do to help continue to support their family. And so vocational rehabilitation, I've served individuals in their 70s, 80s, and 90s that were still working and wanted to keep working, didn't want to lose their job because of a medical condition. Support services and referrals. Again, we like to refer individuals to other agencies that we know can provide assistance for them. And transportation assistance, making sure that they have thought about how are they going to get to work, how are they going to get home, public transportation, getting a ride, individuals that need a vehicle modification for our transition youth, whether they're going to be able to learn how to drive and helping them learn how to drive. So lots of different things related to transportation services. Next slide.
Thanks, Giovanni. I just want to pop in and just give you like a 2-minute warning. I know that we're
Okay.
kind of like we're truncated here at the end, but tell me when you want me to flip through, okay?
Okay. So youth and student services, eligibility and needs-based for students and youth. The core things that we help with individuals that are 14 to 22 is we help them figure out whether they want to go on after high school, whether it's an associate's, a bachelor's, a certification, an internship, an apprenticeship. Then job exploration and counseling. We help with a summer earn and learn program to help them work while they're youth. Work-based learning experiences, work-based readiness training, and helping individuals that are young understand how to speak about their disability and ask for accommodations on a workplace. Next slide. Business services, we do have business relations coordinators in each of our 6 regions that help raise awareness about key disabilities in the workplace. We help employers determine whether they are being ADA compliant, whether they want to hire individuals. We can help bring them qualified individuals, and help make sure that they are doing everything that they can to hire individuals with disabilities. A lot of times employers don't know where to start, and vocational rehabilitation is a great place for them to help them find qualified employees. Next slide. We have a program called We Hire Ability that's an incentive for employers. If an employer has over 10% of people in their workforce that identify as persons with disabilities, then we would like to recognize them. We can do that. They can nominate themselves, someone can nominate them, and that's our We Hire Ability program. Next slide. So eligibility requirements, they have to be present in the state of Texas, legally eligible to work in the United States, have a disability that results in a substantial barrier to employment. So when you ask somebody, do you have a disability? A lot of times what they hear is, am I disabled? And they're like, no, I don't get Social Security, I'm not disabled. Well, if there's something that affects your ability to work, then you are eligible for our program if there's a medical condition that's affecting your ability to work. And then you've got to be able to work to maintain and obtain employment. And that doesn't mean necessarily 40 hours a week. It could be 5 hours a week. It could be 50 hours a week. Whatever you're able to work, we want to help you reach your employment goals. Next slide. And so we serve lots of disabilities, physical disabilities, psychological disabilities, and sensory disabilities. So arthritis, sleep apnea, carpal tunnel, knees, shoulders, hips, anxiety, depression, bipolar, PTSD, vision, hearing, just about any kind of disability. If it's affecting your ability to work, then we're going to try and help you. Next slide. So how to apply for our services? The best way to apply for our services is our call center. The 512-936-6400 is a statewide call center. I know it's got an Austin area code, but it is a statewide call center. Nobody has long distance anymore. So it is staffed 8 to 5, Monday through Friday. It's about a 10-minute phone call. They're going to ask you your social security number, name, address, phone number. They will assign your case to the office that is closest to you by zip code. Then somebody from that office will contact you in about a week to set up a time to take your application. The application can take about an hour to an hour and a half. It can be done in person at an office, by phone, or virtual. If you apply by phone or virtual, we need you to be able to sign forms via DocuSign. If you're not computer savvy and you don't know how to deal with emails and things like that, then please schedule your appointment to come into the office because it's easier to get a pen and ink signature then. And then we do have a Start My VR where people can go to. If you're not available to call in between 8 and 5, it is an extra step. You get an email, you put in your email, you get an email telling you that you need to call or somebody's going to call you. You could always find the office that's closest to you at VR Near Me, or you can email the call center at the address listed on the screen. And next slide. So my contact information, please feel free to screenshot. You can reach out to me. That phone number is my work cell, my email address. If you've got questions, if you want a presentation, please feel free to reach out to me. I cover Region 3, which is Central Texas, but I have 5 other counterparts that cover the 5 other regions in the state of Texas. And then the next slide. It's just, I think I have to tell you that we're a federally funded, one more, federally funded program. 80% of our funds just about are federal and 20% are state funded. And I am required to tell you that. So any questions?
Thanks, Giovanni. So I just wanted to highlight a couple of things that you and I spoke about. You mentioned that the vocational rehabilitation program can help community members who are eligible for it apply for Social Security. Is that right?
So usually we'll refer people to the Center for Independent Living.
Gotcha.
We sometimes, depending, so when I was in Bryan College Station, I had people in that community that I knew I could refer people to. We're more, we can help with medical care. So like if you need a knee replacement or you're going to lose your job, if you need a hernia repair or you're going to lose your job, and maybe you have health insurance or you don't have health insurance. I know when I got diagnosed with my carpal tunnel, I've got state health insurance. My copay was $1,600. A lot of people don't have the money to do that. Same thing with like sleep apnea. The sleep study, my copay was like $600 for a sleep study. And then they turn around and they want you to do a second sleep study. So even if people, are working, that's why we're not an income-based program. We want to help people be able to keep their job if they're already working.
Gotcha. So conditions like sleep apnea, hearing loss, those would be conditions that might qualify somebody for vocational rehab, and then they could come in and actually get some of the services and supports that y'all have for medical care so that they can stay employed.
Right, absolutely. So we're here to help somebody get a job. So if they keep losing a job because of their disability, or they've already lost a job because their employer let them go because they didn't have the money to get their hernia repaired, or they were missing too much work due to sleep apnea, or maybe they, whatever medical condition it is that maybe caused somebody to lose their job, we can help with. We also help with employment and training. And then we also help with education. So yeah, lots of services. If you're a person with a disability and you want to work, we feel that we're going to help you. A disability should not be the reason that you can't work. So
Right.
if you have a disability and you want to work, come see us.
Gotcha. Thank you so much, Giovanni. Yeah, I really just want to highlight the vocational rehabilitation program for community health workers, for application assisters, for financial benefits counselors, because there are like such incredible financial benefits here. And you know, and the focus is on work, right? But really the benefits can be connected to health, mental health, physical health as well. So
Absolutely. I had a
thank you
mental
so
health
much. Yeah.
caseload. I had a mental health caseload for 10 years. And so
Mhm.
people on the autism spectrum, I'm an autism specialist. So that's my passion. But
Yeah.
there are lots of people that have disabilities that want to work. When Social Security, if somebody is getting Social Security, we are Social Security experts. We can help people understand how working would affect your SSI or your SSDI. We provide benefits planning, and so Social Security actually refers people to us. It's called a ticket to work. And so, but you don't have to be on Social Security to receive our services.
Yeah. Gotcha. All right. Well, thank you so much, Giovanni. I have a million more questions for you, and
you.
so do audience members, but we'll get to those after. Up next is Greg from NAMI, Texas, the National Institute of Mental Illness, Texas chapter, and who will be talking about programs for mental health care. And Greg, I am so grateful for your time here. And just so everybody knows, we're going to go over about 5 minutes just to make sure that we don't kind of like truncate our last session too much. But Greg, we've got like about 8 minutes to wiggle with here.
Okay, sounds
And
good.
do you want to share your own slides?
I will share my own slides and
Okay,
I'll
I'll
wrap
stop.
by 10:20 here. Thank you so much for having me. Let me get my screen share up and running and we will jump right in. So as Lynn so kindly mentioned in her introduction, my name is Greg Hanch. I serve as the Executive Director of NAMI Texas, which is the Texas affiliate of the National Alliance on Mental Illness. NAMI is a grassroots organization dedicated to building better lives for the millions of Americans affected by mental illness. And there are 25 NAMI chapters across the state of Texas. Please consider us a resource for you as you assist people as it relates to their mental health. I'm going to just hit the high points on the slide. I won't read you the stats. This slide I put in here just to provide some evidence that mental illness is a fairly prevalent issue that people face. Everyone knows someone affected by mental illness, and I'm certain that enrollment assisters encounter people with mental health challenges on a regular basis, and therefore are looking for options for those people to provide support. Mental illness usually emerges early in a person's life, and without proper treatment and intervention, the consequences can be dramatically negative. So as you're encountering people with mental health conditions on perhaps some of the calls that you're taking, one of the first things you want to do is to assess whether or not it is a mental health crisis situation. Through careful listening and empathy, you can use your judgment to determine if the person is experiencing a mental health crisis and then tailor the resources that you're referring to based on that. We recommend asking open-ended questions to understand the caller's current feelings and circumstances. Questions like, how are you feeling right now? Can you tell me what's going on? And based on that, if you suspect that the person may be experiencing a mental health crisis, let me advance the slide. If you suspect they may be experiencing a mental health crisis, it's important to gauge the level of risk. It's okay to ask someone directly, are you having any thoughts of hurting yourself or someone else? You may also want to evaluate their functionality and their level of support. For example, you can ask, are you taking care of your daily tasks like eating, sleeping, or going to work? Have you been able to talk to anyone about how you're feeling? Do you have family or friends that you can turn to for support right now? Are you seeing a therapist? You may also want to ask about their coping strategies and assess their future-oriented thinking. You can ask, how have you been coping with everything going on? What do you usually do when you feel like this? Have you tried anything to help yourself feel better? Questions like those can help bring out in a person what their circumstances are and what the level of risk is. If you believe that a person may be experiencing a mental health crisis, the right thing to do is to refer them to emergency services. And we'll talk about what the emergency crisis services are first, and then we'll talk about non-crisis resources after that. So 988, I'm sure many of you have heard of 988. This is a national mental health crisis hotline introduced 2 years ago, and it simplifies access to mental health support. It is a 3-digit number that people can call or text when someone is experiencing emotional distress, having suicidal thoughts, or is experiencing a mental health crisis. It's free to use. It's accessible by call, text, or chat. People who access this number are connected with trained mental health crisis counselors. There are specialized options for military families, the LGBTQIA plus population, and for people under the age of 25. There are also counselors who speak different languages through 988, as well as interpretation services available in more than 240 languages. If you encounter someone experiencing a mental health crisis, probably the first resource that you would give to them is the 988 3-digit number for mental health crisis calls, texts, and chat. There are other crisis services that exist. There is a crisis hotline that is operated by every local mental health authority in the state of Texas. We'll talk about the local mental health authorities in a bit. There are also, beyond just hotlines and numbers that a person can call, there are services that will respond to a person on the scene of a crisis. They will actually go out to the scene of a crisis. These have mental health professionals on them, and they provide emergency care and stabilization services. And then for the more severe cases, there are places to take a person to. And those 4 options are listed below mobile crisis outreach teams on the slide. These all vary in severity of cases and the length of stay, but know that there are places that a person can be brought to in the event of a mental health crisis. And they are usually accessed through calling the local mental health authorities or calling 988. Some people may need inpatient care, hospital-based care. There are a few different types of these services. Oftentimes, people access inpatient mental health care through the community-based local mental health authorities. There are also state-run psychiatric hospitals. Most people there are referred from the criminal justice system. So it's not easy for a person to get into them without a criminal justice referral. But there are private psychiatric hospitals as well. A person has to meet criteria to get into these services. And that usually is along the lines of risk of harm to self or others is what results in a person being admitted to a psychiatric hospital. To find these services, 211 is a good resource, as well as the Texas HHSC website.
Greg, I'm just gonna flag just one more minute if that's okay.
Sure, absolutely.
Thanks.
Yeah, so I'm not really going to be able to hit much more. There are residential treatment centers for youth. These are residential facilities for children with serious emotional issues, local mental health authorities, community-based services, accepting Medicaid or low sliding scale fees. These are located in every county across the state of Texas. The Yes Waiver is a community-based program for children with serious mental, emotional, and behavioral difficulties. Many people have the need for housing services. Know that there is a Texas housing assistance line that people can call for help finding housing and getting them connected with the other housing services, often operated by local mental health authorities or Texas Department of Housing and Community Affairs. For substance use disorder services, know the term OSAR, and that is a referral line for substance use services in Texas. Oftentimes, people will access mental health services through primary care. Encouraging a person to talk to their primary care doctor is a good option. I'm going to skip this. This is a particular model in the primary care system for delivering mental health services. For civil law cases, Disability Rights Texas is a good option, referring people there for help in advocating for their rights as well as investigating abuse and neglect violations is a smart move. You can find services through Psychology Today, different types of mental health providers, online mental health services, NAMI online support groups, various apps that people use for mental health support, as well as online intensive outpatient treatment. Thank you for the opportunity to present to you. Know that NAMI Texas is here. You can call us anytime for help, getting help, finding mental health resources for the people you serve. Appreciate the chance to speak with you.
Thank you so much, Greg. I have definitely referred folks to those online behavioral support groups through NAMI, and I just want to shout out that they are remarkable and also accessible for folks who live in rural areas. It doesn't often seem like there are tons of mental health care resources outside of our urban centers, but those behavioral support online or virtual groups are so good. And definitely like the 988 number, huge for crises, but even for those moments when folks are like feeling anxieties or like tensions kind of building, those online support groups can just be like a really helpful release valve. So just want to shout out that a lot of those programs that Greg was talking about are not connected to specific payers, right? We started off talking about money and how all of these programs cost money to people. The local mental health authorities sometimes do take Medicaid, but Greg, a lot of those programs are available for folks regardless of whether they're covered or not. Yeah.
That is correct. The local mental health authorities are the public safety net mental health services and are available regardless of a person's ability to pay.
Gotcha. Well, this has just been like such a good way to kick off the Texas State of Enrollment Conference. We have gotten tons of awesome questions. Thank you to our interpreters for getting through this first session and figuring out the kinks in Zoom events. Thank you so much to our Zoom administrator, Emma, for pulling all the strings in the backstage area. What we're going to do right now is we're going to launch a poll just connected to the learning objectives that are in this session. Next sessions will have more opportunities for Q&A. Now that we've gotten through the kind of like, the clunkiness of the first session with many interpreters. So, and that's that's not a criticism, right? That's just that's a celebration, really. Thank you again. Oh, and thank you to St. David's Foundation for making our interpretation services possible this Texas State of Enrollment Conference. So, Emma, if you could launch the poll, if everybody who is still on the call could take the poll, give us a sense of how you feel like you learned connected to the learning objectives on this call. And while that poll is launched, I am going to share my screen and do a quick raffle. So what I've done is taken all of our registrants for the conference and I put them in a spinny wheel, and I will spin that wheel, and we will identify 2 folks who will get $50 gift cards for sitting through this panel, and we will do that 5 more times in addition to now. So let me just share my screen and we'll get into the raffle part. Looks like I'm still end show. There we go. We've got a big old wheel of names here and I am gonna spin it. So we'll do 2. And if you're here, please go ahead and raise your hand so that I can make sure we take you down for being, oh, sorry. No, I mean, like if you're here and your name pops up. So we've got Jennifer Martinez, who is one of our panelists also. So I'm actually gonna close that one. And let's see, we'll try 2 more times and see who we get. So the wheel is spinning and it's landing on Laura Chikaiza. Laura, if you are here, raise your hand. Let me see whose hands are raised. Laura Chikaiza, if you are here, raise your hand. I don't see Laura. We'll spin again. And I see Gallegos. Let me see here. Sylvia Gallegos. Sylvia, if you're here, raise your hand in Zoom if you can. I'm going to check through this list also. Sylvia. Oh, there's Sylvia. Okay, Sylvia Gallegos is one of our winners. Awesome. Okay, and we get one more here. Let's close. I'm just gonna write that down. And Michael Goldstein, who I know is not here. So we'll spin again. I don't have a list of the people who are just on this call. I just have a list of everybody who registered for the conference, so it might take a couple of times. And Jennifer Garcia, let's see if Jennifer is here. Okay, Jennifer Garcia, I see you in the list. Awesome. All right, well, so we've got Sylvia Gallegos and Jennifer Garcia as our two winners for our first two gift cards here. Thank you so much, everybody, for taking the poll. We're going to go backstage and welcome our presenters for our next panel, and we will see everybody in just a few minutes. Thanks so much, y'all.